Hello, everybody. Welcome to today's lecture, and we're covering the cellular level of organization. So I cover most of this PowerPoint in my video lectures 1 and 2. So please watch those videos if you need to review the material. And we're gonna start with the physiology part today. All right, so I will try to use a pen to highlight important information, see how it works. Right. So we want to start our physiology part talking about basement membrane. So it's a thin, pliable sheet-like type of extracellular matrix that provides cells and tissue support. So if you look at diagram over here, you can see our epithelial tissue, and it's resting on a basement membrane. Now, basement membrane is extracellular matrix, so it's mostly made of fibers over here, of proteins, and it's divided into two lamina, basal lamina, most superficial, basal lamina here, and reticular lamina. So basement membrane sits between epithelial tissue and underlying connective tissue. And it's not just epithelial tissue, it's also mesothelium, that is epithelial tissue covering your heart and blood vessels, and endothelium that covers GI tract. And it's made of basal and reticular lamina. So what is significance of this membrane? What is homeostatic imbalances that we can mention here in relationship to the basement membrane? Now, if you see here your normal cells, epithelial cells, they're sitting on a basement membrane, right? So right here, and epithelial tissue is avascular. So that means we don't have blood vessels where we have epithelial cells, but underneath we have connective tissue, right? So that's our connective tissue, and we have blood vessels. So your normal cells, actually, they have this boundary, basement membrane, right? So they stay in an area where it's supposed to be. Now, cancerous epithelial cells, they are not contained by the basement membrane boundary. They can penetrate it and invade underlying tissue. They can migrate inside your blood vessels, and it can cause the spread of cancer that we call metastasis. So the clinical significance of the basement membrane is that this is a boundary for your epithelial cells. Another information we want to learn about tissues, we already know that tissue can be divided into vascular and avascular. And epithelial tissue is one example of avascular tissue. Another example would be cartilage. Cartilage is avascular compared to bone, for example, that is highly vascular tissue. So let's compare vascular and avascular tissue. Well, this A means it's missing something, right? And vascular means blood vessels. So avascular tissue does not have blood and lymphatic vessels. And vascular tissue has blood and lymphatic vessels. Now this table kind of tells you like, where is the arrow over here? What does not make sense? And what doesn't make sense is this box need to be here, and this box need to be right there, because if we have vascular tissue, that means we will have capillaries, arteries, veins, lymphatic vessels, right, in the vascular tissue, and we will not have arteries, veins, capillaries, and lymphatic vessels in avascular tissue. And because of that, we will have a good supply of blood if tissue is vascular, or we will not have sufficient blood supply if tissue is avascular. Now, examples of avascular tissue, we already mentioned epithelium, right, and cartilage. Here's two other tissues, cornea and lens. You know, both are found in your eye. Cornea is the most superficial. It's not well, this is anterior covering of your eyeball. Now let's put it this way, right? So if you have your eyeball, right? So here's your eyeball, and here's your anterior part, right? That's where the cornea would be. Examples of vascular tissue are muscle tissue, liver, lungs. Very good example of vascular tissue would be also your bone. Here's some homeostatic imbalance. Avascular cartilage loses ability to divide as we age, so injuries heal slowly. Right? Not only those chondrocytes stop dividing, but because we do not have enough blood supply, right, we cannot heal very well. So it's common in people with sport injuries. Later in life, cartilage can calcify or ossify, become bony, causing chondrocytes to die. So talking about a vascular tissue that is really heals much better than avascular, let's look at a process of tissue healing. Now, tissue healing will depend on a type of injury. Either we have acute injury or chronic injury. Now, if you have chronic injury, when we have persistent tissue damage, this tissue will always repair itself by fibrosis. And fibrosis means we're going to form tissue scar. And tissue scar made of connective tissue. So example of fibrosis would be chronic inflammatory diseases like cirrhosis, chronic pancreatitis, pulmonary fibrosis. Now, if we do not have persistent damage, if we have acute injury and the major cells may be dead, right? But the framework of tissue is still intact. Or when we have damaged tissue framework. Now, example of the type of wound when you still have your tissue framework intact will be superficial wounds. Example of the damage with the damage of framework will be your deep wounds. So here we have some inflammatory processes. Here we have a more severe inflammatory process. Now, if we have acute injury, we can still form a scar. So we will heal by scar formation that we can call repair, or we can call fibrosis as well. So we can call it fibrosis because in this example of that, we form scar tissue. But the good thing about acute injury, and if we do not have extensive damage and prolonged inflammatory process, we can heal by regeneration. And some tissue, they're just good at regeneration. Now, how regeneration is different from fibrosis? So let's just call all this fibrosis. And let's just say that when we have persistent tissue damage, or when we damage the tissue framework, we repair by fibrosis. Now, how regeneration is different? In regeneration, we restore normal structure and function. In a fibrosis, we lose some of the function. So here would be the example. you have a patient with myocardial infarction. That means that muscle tissue of the heart is damaged and some cells are dead. Now, when your heart cells are dying, those muscle cells, cardiac muscle cells, they will be replaced by connective tissue. So your heart will heal, right, after this myocardium infarction, that is death of the myocardial cells. But those cells, muscle cells, will be replaced by scar tissue, connective tissue. Now your muscle cells, they can contract. They can propagate electrical signals. Scar tissue cannot contract. It cannot carry on electrical signals. So you see here, you lose some function, right? That would be fibrosis. Now, regeneration example would be either very superficial wounds or, by the way, liver. Liver regenerates very well after partial hepatectomy. So liver can pretty much regrow, right? And restore its function, right, completely. So that's a good example of regeneration. So just a very quick summary, we compare vascular and avascular tissue. We also said that if you have a vascular tissue, that it heals slowly, right? And now how tissue heals itself? It can be done by regeneration when it's restitution of normal structure and function, or by fibrosis when the tissue framework is replaced by scar tissue, right? And then it will result in a loss of some functions, right? Now, what are those phases of tissue healing? So that would include hemostasis, and please do not confuse hemostasis with homeostasis. Homeostasis is the ability of your body to keep stable internal environment. Hemostasis is when your body stops bleeding. And this is day 1 to 3. Then day 3 to 20, we will have inflammation. And of course, it will depend how severe the damage is, right? It might be a day or 2, it might be 20 days, right? But we will have inflammation. Week 1 to 6, we have granulation or proliferation. I like granulation because actually you are forming granulation tissue. And stage 4 or final stage, week 6 to several years, is maturation and remodeling. Now, what inflammation is? Inflammation has these 4 and sometimes 5 sides. Inflammation means the site of injury will be red, you have swelling, you have pain, you have heat, and sometimes loss of function. So, and this is our phase 2, inflammation. So let's see what we have here, right? So step 1, we have bleeding at the site of injury, immediately after injury. Why would we have bleeding? Because most of your tissues are vascular. So in this example, you have damage, you damage your skin. So you have cuts through epidermis and dermis, and epidermis is avascular, but if this wound is deep enough, if cut is deep enough, then you cutting through dermis, and dermis is very vascular. So you can see those blood vessels. If they're damaged, you have bleeding, right? Now, when you have bleeding, and so when your blood is not inside your blood vessels, right, it's pretty much immediately start coagulating. Now, what is coagulation? it's a multiple step process of transformation of your blood from liquid form to semi-solid or gel form. So you will have the special proteins in your blood plasma, right? And when those proteins are activated, you will start this coagulation cascade that will turn your blood from liquid to gel form, right? So pretty much coagulation starts immediately. Even it says after several hours, but you know, we usually do not bleed for several hours, right? Coagulation starts right away within a couple minutes, but within several hours, we form a scab, right, on a surface of this cut. Right, so you have your injury, you damage your cells, obviously. Now, those cells that are damaged, plus you have cells that we call them mast cells. When there is a sign of injury, right, they start secreting inflammatory chemicals. And what those inflammatory chemicals do, they cause the blood vessels to dilate. And when blood vessels dilate, you will have white blood cells migrating to the site of the injury, right? You will have, because that's your connective tissue. Connective tissue, you have fibroblast migrating here as well. White blood cells migrating here, right? Now, white blood cells, macrophages and basophils, but those are white blood cells, and fibroblasts pretty much accumulate in this area. Now, macrophages, they're removing debris, right? Fibroblasts, they start secreting collagen. So you have this collagen, you have fibroblasts, you have macrophages, and you're pretty much forming this new type of tissue. We call it granulation tissue. This is this next step in a tissue repair that is called granulation. So what is granulation tissue? Pretty much collagen, fibroblast, and white blood cells, right? At the same time, you start formation of the scab and coagulation of the blood, right? See what else is going on. Now, those are epithelial tissue. Now, those epithelial tissues start migrating, right? That's migrating over here along the edges of the wound. Right, and clotting around the edges. So your clot starts around the edges first. It's pretty much isolates this region, partially isolates this region, and you form scab. Next, after about a week, we can see that those fibroblasts depositing lots of collagen over here. And that's what our scar tissue is, because you can see the alignment of these fibers is not exactly the same as it was before. So they more randomly arranged. So that's a scar tissue is forming. So we have now less white blood cells because most of the debris were removed. Now those epithelial tissue now start pushing this scab to the surface and pretty much kind of completing this covering underneath of it, right? Now, then this is our last step, step number 4. After several weeks, the scab has been shed and epidermis is complete. So epidermis over here actually heal by regeneration. So you can see here. So we heal epidermis by regeneration. because we pretty much have the same structure as we had here before the injury. Yeah, we do have some depression mark over here, but the scar tissue underneath will continue remodeling and gradually will elevate this overlying epidermis. So how and this is your skin, obviously, right? So how your skin will heal after injury, it will have regeneration of epithelium on the top of scar tissue, right? And that will be tissue repair, right? So that's what we have. We had our bleeding first, then we have hemostasis, stop bleeding. We had inflammation, formation of granulation tissue that is made of or consists of fibroblasts, white blood cells, and collagen fibers. And then our wound will remodel and mature. So we will have repair by scar formation of dermis and regeneration of epidermis. What I forgot to mention over here, those cells that migrating along the side or edges of the wound, this layer of cells is called stratum germinativum or stratum basal, right? So those are cells that are there are stem cells over here, and they can divide, right, and replace cells that are damaged. This is why we have complete regeneration, because cells of stratum germinativum, they divide and they replace cells that were damaged previously, right? Okay, and the last slide in this PowerPoint cover a little bit tissue and aging. Now you can see tissue in a newborn, in an adult, and in an old patient here. So what we can see here. So let's see first what we know, because some of this you guys need a little bit of explanation, but you can see that we have low DNA damage in a newborn, then we have modest DNA damage, and we have high DNA damage. Now telomeres are part of your chromosomes. So if you have a chromosome and you have one end of, so here's, for example, your chromosome, right? And you have this end and this end. So you have telomeres on both ends, and those telomeres prevent your DNA from damaging. So we want a long telomeres. You want our DNA to have long telomeres, that this prevented from damage. And you can see we have long telomeres, and they medium and short, and that's why we decrease the DNA damage. Now this INK4A protein, it's shown over here, are cell cycle inhibitors. Now, what is cell cycle? Cell cycle, when your cell goes through the stages of growing and DNA replication, and then cells can divide. So if you inhibit this cycle, that means you decrease the ability of your cells to divide, right? And if cells cannot divide, then you cannot renew your tissue very efficiently. So tissue renewal is optimal when you are very young, and then efficient when you're adult, and inefficient when we get to our old age. Right. So also you can see that more and more tissue grows, cells go through a process that's called senescence. So it's very high senescence, and senescence is apoptosis. So more and more cells are just pretty much died. Also, these older age, we reduce elasticity of tissue, decrease collagen production. If you're talking about muscles, we will have muscle atrophy, nerve impulses slow, and we have more of these INK4 proteins that will inhibit the cell cycle, prevent tissue from renewal. Right? Okay, so that's it for the last part of this chapter. Right, thank you for watching, and I hope it was helpful.